I'm going to discuss erectile dysfunction as well as penile prostheses in the patients following treatment for their prostate cancer. Penile prostheses come in a variety of devices, which include a malleable prosthesis, where the patient is able to control without the use of a pump into bringing their penis up for an erection and down. Another option includes an inflatable device, which includes a two-piece device, or ambicor is the most common utilized two-piece device, which includes a pump, a scrotal pump that's required to inflate the penis. This is inserted into the scrotum itself. The last of which is a three-piece inflatable penile prosthesis device, which also has an option of the length and girth of the penis as well. However, it uses an abdominal reservoir which stores fluid, and that is communicated into the cylinders that are inserted into the penis itself. These procedures are now commonly performed as an outpatient, but at maximum usually require a one-day hospitalization for intravenous antibiotics. There's a greater than 90% satisfaction rate, both of patients as well as their partners, following these procedures, and is an excellent minimally invasive way to bring back the vitality of our patients. So a penile prosthesis can restore sexual activity to our patients, and quite commonly a question that I have is whether or not the sensation or feeling of the prosthesis is similar to as that before they had a procedure. The sensation of an erection remains the same in regards to the feeling at the skin level. However, the ability to have the erection is restored. Obviously, patients undergoing a robotic prostatectomy or open prostatectomy have their prostate gland removed, and at that time and prior to this should be canceled, that ejaculation cannot be restored, and this is not the case, of course, with the insertion of a penile prosthesis. What is in fact restored is the ability to have intercourse.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment, or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.